Hello everyone and a warm welcome to the Morning Call with Jerry Bambi. Now, at first, there were little or no cases of coronavirus infections in Africa, something that seemed to have puzzled many on how countries on the continent have largely managed to dodge the brunt of the disease. But maybe not anymore. There are now over 40,000 cases of the deadly coronavirus across Africa, according to data from the Africa Centers for Disease Control and Prevention released on Saturday. And the death toll, more than 1,600 in several African countries, as the continent continues to grapple with the pandemic. Now, are these figures encouraging 3 months after the first recorded cases on the continent? And regardless of that, is Africa on track to reduce the scale of the pandemic? The Africa Centers for Disease Control and Prevention, which coordinates pandemic responses across the continent, says there is a large gap in testing rates between nations on the continent. Testing, it says, plays a major role in the response to the virus, as it helps us understand how far the disease has spread. So far, smaller nations like Djibouti, Mauritius, Ghana, and South Africa have achieved relatively and significantly better rates of testing than their larger neighbors. Full and partial lockdowns have also been a measure adopted by several countries for a while now, but that is beginning to ease in the face of economic concerns. There are new worries and fears. Is the worst over, or is the continent just about to experience its terribly fair share of the pandemic? With us this morning is Dr. PELE, a specialist in public health, epidemiology and tropical diseases. Dr. PELE, a warm welcome to you. Thank you for joining us. So in March, the UN Secretary General warned of millions of deaths in Africa related to COVID-19. Just last week, the World Health Organization, WHO, called on African countries to maintain tough measures to combat the spread of the virus as some countries began to ease lockdowns. Now, what do you make of these warnings and the current state of things? Is Africa on track in stamping out this disease?
I have the impression that we are at the beginning of the epidemic and it's slow, but surely progressing. And I hope in any case, we all hope that we will not have a massive epidemic infection like in China or Europe or United States of America. Because in view of our very weakened health system of our economies, we are going to pay a very, very heavy price. And therefore, I personally think that we are at the beginning and we have a lot of sick people, but there are bills that will make us have a lot of sick people. We have 25 million people living with HIV in Africa, and some of them no longer have access to treatment. There are also pathologies such as diabetes and hypertension, all of which can be treated. These diseases are comorbidities and could cause us to have a very high mortality rate. We have also found out that it is in the adult age bracket that we have a large number of sick people, because we simply do not have many people who are in over 80 age bracket. That is to do with our demographics.
Now, that doesn't sound very optimistic, Dr. PELE. Nigeria today relaxes its lockdown in two major cities, Lagos and Abuja, and goes on what it has described as a gradual easing. Other countries on the continent are in the process of relaxing the confines. In fact, if they haven't done so already. Now, do you think that they're walking on eggshells?
Containment is not the appropriate strategy for Africa. Africa must invent its own strategy towards this virus according to its economic environment, its social environment and its culture, its knowledge, and above all the dynamics of the epidemic. Taking into account what we know now about the virus, of the disease of the epidemic, many countries, by adopting containment policies, countries like what is happening in Europe, But Europe is not Africa, like China, but Europe is not. China is not Africa. We must invent our own response, taking into account the scientific argument. A country like Benin adopted strategic appropriate to its situation. It has adopted a strategy of the cordon sanitaire, which consists in closing the cities where there are cases of COVID-19. No one can go in or no one can go out. No one can go out and monitor the dynamics of the epidemic in these areas. Again, they have asked each person to wear a mask.
And it is interesting that you say that, mentioning the example of Benin there, as this actually has been a talking point on how really effective these lockdowns are on the continent. But away from this now to the issue of remedy and cure, Madagascar has presented something that he says is a strong remedy for the disease. COVID organics, it calls it, as Africa finally found its miracle cure for the coronavirus.
In all cases, there is a lack of treatment and vaccines, as in the case of hydrochloroquine and antibiotics that slow down severe cases of COVID-19. And the right to try everything. I think that Africa also has the right to try everything, but let us do so in all humility and by taking steps to carry out studies that will enable us to show the world that Africa has scientifically made it possible to find one or more medicines that can either slow down or cure or have an effect on the body of COVID-19. But what I can tell you on this subject, I am a member of the working group on COVID-19 of the National Academy of Medicine of France. We are going to get in touch with our Malagasy friends so that at a scientific level, at the Malagasy Institute that works on this product, I will take and analyze together the results that are obtained so that we can either support or tell them attention. There may be to be one of them is my modest contribution, if not proposal, on this subject.
And how pleasing this must be to hear for the many proponents who say that it is not just enough to discount this, but it is important to take a look at it and for all African health experts to work together in finding a cure. Dr. PELE, many, many thanks for speaking with me this morning and sharing your insights with us. Thank you very much. Dr. PELE, public health epidemiology and tropical diseases expert, speaking to us there from Cotonou. We move on now to bring you some other stories making headlines across the continent.